This is a full view. Welcome back. Now, tomorrow is World TB Day, and many programs across the globe and the country are in full swing, creating as well as giving awareness about this disease. And despite TB being a treatable as well as preventable disease, data from the World Health Organization shows that in 2022 alone, 54,200 people died from TB here in South Africa. Now, that translates to one person every 10 minutes. So we are trying to be part of the message and partake in arming our citizens with the vital and relevant information that could save them or their loved ones from this disease. And for this discussion, we have roped in Mr. Russel Rensburg, health activist for the Rural Health Advocacy Campaign, as well as Nqobile Shabalala from Treatment Action Campaign, Capacity Building, and he is the coordinator. Welcome to both of you, gentlemen. Thank you so much for your time. Nqobile, look, let's start with you. As the TAC, you recently staged that march to the health department premises. Talk to us about some of those objectives that were contained in that memorandum and if you feel that they were achieved.
Thank you very much. I hope you can hear me.
Yes.
Thank you, and good evening to you and your viewers at home. We had the march in partnership with the TPEC, in partnership with the Rural Health Advocacy, to speak with the National Department of Health, to speak with the Minister of Finance, to speak with the presidents about the issues. So if you look at what our message is, we had 4 key messages or 4 key demands that we were raising with them. And so fortunately today, as we speak today, we had an opportunity to have a district accountability meeting to also speak about the 4 key issues. Now we are having 8 issues that we raise with the minister, we raise with the Premier of Gauteng, we raise with the MEC of Gauteng. So basically what we see now, what we are looking for now, we are looking for the date and the time to say RAP, TAC and TPEC and other partners come together. Let's sit in a round table and discuss your issues. Remember, one of the things that we agreed with them is to say they will respond in 14 days. So one of the things that we're looking at in the response in 14 days is to give us time and the date so that we can go and discuss these issues in a round table with them, so that we can take these issues further and discuss it further with them.
Now, Russell, you and I had a conversation on Human Rights Day about this very topic. You said there have been significant decline in the number of deaths related to TB. So what I want to know from you is, what then are some of the persistent challenges in eradicating TB? I know you mentioned, of course, funding as well as budget cuts, but paint us a clear picture of those hindrances.
To end TB, we must find TB, right? Our current approach really is very facility-based. So the people that test and the people that get into treatment are more than likely those that get to the facility. But TB is within the community. In the last World TB report, the patients that we suspect may have got TB that didn't pitch up at health centers was like around 88,000, right? And that's a significant amount of people who have been missed through the treatment cascade. And then on the department's own numbers, you know, of the people that actually do get a positive TB test, only 67% of them actually graduate onto treatment. And then even those who graduate onto treatment, only 75% of them manage to complete their treatment. So somewhere along the line, there's a host of different factors. The first is, are we testing the right people? Are we finding people in the right places to be initiated into TB treatment? The second thing is, those that are positive, are we notifying them sufficiently? Are they able to start treatment quickly? You know, and when we lose patients along the cascade, I think we just add to the problem. So what we were calling for in making TB a national emergency and a political priority is that we can start employing different tactics to addressing the TB problem. And I think that has to come from the highest office.
Look, Nqobile, we know that there's been a recent announcement of an integration of those testing facilities of the TB as well as HIV testing facilities that had to be combined. So what I want to know, I mean, what have you uncovered in your research as to what actually perpetuates these infections? Is it certain demographics? Is it areas, or even gender-related issues? Nqobile, if you're still there. Okay, I think we've lost Nqobile. Russel, if you can take over, I think we've lost Nqobile on the line, but please go ahead and answer if you can on that question, sir.
No, certainly. I think obviously TB is a very clustered in about 14 different districts, which are highest burden. So districts are generally in the Eastern Cape, the Western Cape, KZN, and Gauteng to a limited to a certain extent, given there's such a large population. The particular groups that we're missing out on men. Men are not presenting for treatment and are underrepresented in TB treatment statistics. And then, there are other challenges that people with TB face that complicate treatment. We know from COVID, when we tested cohorts of patients with TB to see whether TB would be an accelerator for COVID infection. We also found that there were high levels of diabetes, often undiagnosed. And I think all of these things contribute to TB treatments not being completed on time, or people not being able to adhere because there's complications with the medication. But I think the single biggest issue that we do need to address is finding TB in the community, right? We can't, just waiting. And because TB doesn't have a point of care test, invariably you come and you get screened. If you're screening only 50% of the patients, maybe that get screened, that even report all the symptoms according to standardized patient trials, get migrated to a test. Once they've had a test, they have to come back to the facility. And I think that lost follow-up between when they've actually been motivated enough to get a test and then returning to start treatment is an area that we need to look at. But definitely we know where the cases are. We know which populations it predominantly affects. And we do need to invest heavily in getting out into the community and making everybody aware of the risks around TB and present opportunities to test.
Now, Russel, your organization is calling for the Department of Health to give TB the urgent attention it deserves and make it a national crisis. How do you propose they do this? Are you currently in engagements with the various authorities and entities to forge those sustainable as well as realistic programs, as well as maybe talk to us about the testing facilities? How widespread are they? What are the processes to get tested, as well as access to, dignified treatment at those centers?
Yeah, I think at the end, the TB testing is available in all clinics, and there are over 3,500 public sector clinics around the country. Right, I think the second step is really just doing with community health workers that we did during COVID, giving them specific training around TB screening and getting them involved and making people part of the response. The third component is just using community leadership and community structures, as advocated by the TB recovery plan, into making them part of the response and not the subject of the response. But I think when we talk about making TB a political priority, what we're asking for is for, at a national level, that all politicians, regardless of which party they are, make TB one of their key health campaigns, right? It's the leading cause of deaths among South Africans. Right? Yet it doesn't feature in many of the election manifestos that have been published to date. There are no clear strategies of how we strengthen community health and primary health care in particular. And I think this is where TB manifests. So when we talk about making it a political priority, it's firstly about, at the political level, making sure that we align TB with the progressive realization to the right to health, because it's a clear demonstration of that, prioritizing the groups with the least access. The second point is to make sure that every plan or the national department's plan for the TB to eradicate TB is fully funded, and that the national TB program is sufficiently resourced to be able to implement and coordinate the plan. And then thirdly, that all provincial departments of health, particularly the Western Cape, Eastern Cape and KZN, have clear emergency plans that they communicate with the public to show how they will prioritize TB treatment, care and prevention, right, in their budgets on an annual basis. And I think lastly, at a national level, the Parliament can call a special committee. The department, the Portfolio Committee of Health in the new administration could possibly sit together with the Finance Committee, call all the provincial departments of health and make TB a political priority over the next 3 years. And I think that's how everything is politically determined, and the pace that we go at it is the level of political priority that is given to the issue. And I think with TB, we are there now.
All right, Russel, thank you so much for your input as always. That is Mr. Russel Rensburg, the health activist for the Rural Health Advocacy Campaign Group, as well as we had earlier Nqobile Shabalala from the Treatment Action Campaign, and he is the capacity building coordinator. That we're talking about TB since it is, of course, World TB Day tomorrow.